So we're going to go through the different neurological exams now, just to give you a bit of an idea of what we're looking for. So to start with, we're going for a motor exam, and this is the way that I would do it in a care setting. Basically, you're looking here, firstly, if somebody can walk on their heels, which will give you an idea if someone's got a foot drop, and this is looking at the L4 myotome. Then walking on their toes. Again, if they're not able to walk on their toes, that's suspicion of a S1. Then if you can get them into supine, you want to look at their L2, which is going to be with hip flexion, and you're getting them to resist this. And you're looking for differences in sides here, or whether they've got any weakness that they've identified as well. Then for L3, you're looking at knee extension. So you've got their knee over yours, you're trying to get them to push up against your hand. And then for L5, you're looking at big toe extension. So just making sure that they can pull that up, and it's probably best to do that with their shoes off. You can do L4 and S1 in supine if they're too uncomfortable to perform these in standing. But keeping in mind as well that somebody can have reduced strength in any of these movements secondary to pain. So it's important to try and differentiate this from motor weakness, which you can do by asking the patient or observing their reaction. Sometimes they'll be able to tell you, again, whether that weakness there is because it's too painful to push any harder or whether they feel like they actually can't. In terms of sensation, in an acute pain setting, the most important determination you want to make is whether there are any sensation differences side to side for light touch. So we'll go through this video again. To do this, you get the patient to close their eyes, and I'll go around each leg asking the patient whether they can feel it and whether it feels different side to side. Ideally, this is done against bare skin, and in this demonstration, you definitely want the shoes and socks off. If the patient identifies any differences between the two sides, you want to try to determine whether it's dermatomal, and you should have a picture in your mind of the different dermatomes and whether that relates roughly to the area of numbness. A lot of people will report altered sensation in different parts of their leg, but if you've got somebody who's got lower spinal pain and they've got sort of altered sensation around their anterior hip or their anterolateral hip, then that's probably not going to be correlated with a dermatome, and it's probably more likely to be just a bit of, again, somatic paresthesia that they're getting.